Good morning, everyone. Welcome once again to Health Talk. It's sponsored by Providence Health and Services, Western Montana. My guest in studio, Dr. Bradley Pickhardt. And Brad, you one of those guys, quite literally, who needs no introduction. Anybody who's been in Missoula for a while knows about Dr. Pickhardt. So can you tell me just a little bit about yourself and how long you've been in Missoula and how long you've been working with St. Pat's?
Needs no introduction. That must mean I'm an old guy.
So I'm just going to leave now.
No, I've been in Missoula for 25 years. Couldn't imagine being any place else. If surgery gets a little dicey, I might change careers, but I'm not leaving Missoula. I do general surgery. That means we do a little bit of everything.
Mm-hmm.
I certainly think general surgery is a specialty. It encompasses hernias, gallbladders. In our practice, it encompasses trauma care, weight loss surgery, and varicose veins, what we're here to talk about today.
Sure. Now, I remember that for several years, you were also a health reporter on a local television station, too, right?
Well, that was one of the outreach efforts that we made at St. Patrick and the American College of Surgeons. That was a great run of 6 years. I learned a lot, had a great time.
Isn't it? It's fun having the microphone run up your shirt and all.
I don't know about that.
Cut. all that good TV stuff. Well, this is live radio. So anyway, let's talk about varicose veins. People may think, well, gee, why do you want to talk about varicose veins for? Well, perhaps because it's a very common problem, right?
It's part of the human condition. Most of us get these things, but nobody talks about them. It's
right.
Kind of analogous to hernias or hemorrhoids.
Okay. So what is it? What is a varicose vein? We may see, oh gosh, that looks kind of unsightly, or we see someone with what looks like that, and we don't know really what it is.
Exactly. Well, you know it if you see it.
Right.
We all do.
Right.
They span the spectrum of the little spider veins that most of us get during our lifetime, to the ropey, prominent, dilated veins,
Mm-hmm.
or the worst case, when people have skin breakdown. But it's malfunction of the valves in the veins themselves.
All right. And so how do you ascertain what the problem is and how serious the problem might be?
Well, first, if we could, let's talk about the function of veins.
Sure.
Blood is pumped to our toes at 120 millimeters of mercury. It gets down there, and then there's zero pressure.
Right.
It's got to beat gravity to get back to our heart. It's pumped back by the muscular pump of our leg. Wiggle your ankle, squeeze your calf, walk. Generates huge amounts of pressure. That blood is squeezed back toward the heart. Muscle relaxes. It would fall back to the floor if there weren't a series of one-way valves. Those valves snap shut as the blood cell goes toward the heart, and it keeps it from falling back to the floor. Veins dilate, valves break down, the veins get dilated. They pool, blood gets stagnant in our legs.
So we are fearfully and wonderfully made, aren't we? I mean, you think about all these various things that you have no idea the processes that are going on in your body. Thousands and thousands of things that are happening every day, and when they don't go right, we have to turn to someone like you to say, okay, so what do we do when we notice this type of situation? We're seeing these spider veins or the larger veins. I mean, is it something that we can just kind of let it go like a tune-up? It can wait another 100,000 miles, or what do we need to do?
Well, it just depends. I have varicose veins. Mine don't bother me, so they don't need any attention. It is when they bother me that they need attention. My legs are heavy. My legs ache. They swell. Some of the symptoms may be so vague that my skin dries out and I'm scratchy all the time.
Mm-hmm.
But the real reason to address them is that they're symptomatic. To know who is going to go from the spider veins to the ropey things to vein ulcers, now that's a little harder to predict who's going to progress. There's really not a good way.
Yes, I was going to ask you where varicose veins can go if left untreated. What's the worst that can happen to you?
Well, as we said, swelling, pain, that's one thing. But as the veins allow stagnation of the blood in the legs, the skin doesn't get as much oxygen, and pigmentation changes on the ankle, on the shin, and ultimately skin can break down, leaving a difficult to heal ulcer.
Okay. We're going to take a little break here, 721-1290. If you have a question for Dr. Bradley Pickhardt, we're talking about specifically varicose veins and the symptoms that surround that. If you have a question or a comment, give us a call, 721-1290. John will be happy to take your question, pass it along to Dr. Pickhardt. We'll be happy to answer it if possible. Our number, again, is 721-1290 or 1-800-568-5309. You can also make your comments or questions on our Facebook page, and we're coming right back with more of Health Talk. Hey, we're back on Health Talk right here on KGVO, sponsored by Providence Health and Services Western Montana, talking with Dr. Bradley Pickhardt. Today we're kind of focusing on varicose veins. John asked an interesting question during the break. Are varicose veins a symptom of something else happening? If it isn't just you're standing too much or not getting enough exercise, well, what other things can cause this or at least have symptoms that are similar?
Well, it's important to go to somebody who has the big picture. Other things can cause swollen or discolored legs, maybe congestive heart failure, a heart problem, maybe a blood clot in the veins of the legs, maybe problems with the arterial system. Just because my legs are discolored or swollen doesn't necessarily mean I have varicose veins or other possibilities.
Sure. So it could be something more serious then. So are varicose veins primarily simply a cosmetic problem, or is it something that we really need to address? Even if I don't care what I never wear shorts, whatever, I don't care what my legs look like. Should I get them looked at anyway?
Well, again, the reason to have them evaluated is they bother me. If I don't like the way the spider veins look in my leg, I can have them addressed, but my insurance isn't going to cover those. If my legs have varicose veins, I'm symptomatic, legs are heavy, they're swollen, any number of those symptoms, insurances usually cover that, but that's the reason to do it. I'm symptomatic.
Okay. All right. Go ahead, John.
We had a question from Richard. He said, can you describe the breakdown of the skin around varicose veins? He says that he has swollen legs and that he notices brown spots on his legs.
Well, discoloration changes happen, and then the skin can break down, the epithelium, and it just is left with a ulcer that oozes. Again, other things can cause similar findings. Dermatologic conditions, arterial insufficiency, ought to go to your primary care provider and have those looked at.
Now, in our business, of course, yours as well, we stand up all day long. And so am I in danger? I've been in radio for 42 years, and I don't think I've sat down very much at all during my career. So am I in danger of developing this, or because I try to keep in shape, run a little bit, do some weightlifting, keep moving, walking, that sort of thing? Am I in danger of developing this?
It's not one thing that causes varicose veins in anybody. It's different factors in all of us. Females, more likely. Pregnancy takes its toll on veins. Standing, you bet. Previous blood clots in the legs. Different doses in different people.
Now, what about family history, things like that? Is that something that could be genetic or heredity?
Yes, genetics can play a role in it. If your parents had varicose veins, well, you may as well, but it's different doses in different people.
Right. So when it comes to getting these repaired, talk to me about how that's actually done. What I realize there's probably a stair step of seriousness of what the surgery is going to be like. But are there some methods that aren't quite so invasive? Because we hear about surgery on my legs, kind of freaks me out a little bit. But are there other things that can be done, other treatments that can maybe forestall that surgery?
Well, the first thing we want to do with any condition is to treat things conservatively. Compression garments, either socks or specially made garments, elevation, maybe some aspirin. Those conservative management efforts won't do away with my veins, but they may treat my symptoms. Mm-hmm. And in fact, most insurances require at least 3 months of trying those things to see if they're going to help before they'll consider approval of any other interventions.
Now, I've heard the term oblation. Is that something that can be done with varicose veins or not?
Ablation is the newer treatment as compared to the old days when we used to strip veins. Very violent kind of
it sounds
procedure.
violent.
It was outpatient, but people were out of work.
Right.
You know, it was painful.
Yeah.
Now we close veins using, we scar them shut with radio frequency or laser energy.
Wow.
Insert a catheter into the vein and scar it shut by delivering that energy to the inside. It's something we do in the office under a local anesthetic. People are up and functional, back at work the same day or the next.
Well, that sounds really exciting. I mean, because for folks who maybe have a history of varicose veins and we see them in ourselves, maybe we're afraid to wear shorts now because we have a problem. Maybe something like this would really bring some hope to people.
It's a lot better than it used to be. That's certainly true.
Go ahead, John.
Yeah, we had a question from Greg. He wants to know if varicose veins are related at all to cellulitis and chronic vein insufficiency.
Well, varicose veins are in the spectrum of chronic venous insufficiency. Chronic venous insufficiency means my valves don't work. It means that I may have had blood clots in my deep veins before. A lot of different things. But what happens is the leg is congested, blood stagnant, and it makes one of the other things, it predisposes me to leg infections, cellulitis, infection of the skin.
All right. So is it primarily, does it strike one leg or both legs at a time, or does it depend on whether you're right-handed or left-handed? Doesn't matter?
Doesn't matter. Could be one or both.
Okay. So chances are, if I see varicose veins in my left leg, can I expect it eventually in my right, or?
Well, again, body tends to be a mirror image of itself.
Okay.
But you treat because of symptoms. I have lots of people come in and say, you know, here's what it looks like, but this left leg, it's the one that bugs me. And that's what we address, the symptomatic side.
Sure. So when somebody comes into you, primarily do they come in primarily because of what it looks like, or perhaps because it's painful, or maybe just they're a little bit scared because things are happening in their body they don't understand?
Well, it depends. Most people that come through their primary care provider or have been to one of our vein screenings, they're coming because of symptoms. And again, coming back to that's the reason to treat it. The asymptomatic ones, no. Even minimally invasive techniques. Take care of your legs, but if they're symptomatic, then that's time to do something.
So talk to me about these vein screenings. I know that every now and then we'll hear that there's a screening for this and that and the other thing, maybe a cancer screening or whatever. When I hear about a vein screening, what kind of things will you do during that operation when you're looking at the legs?
Well, just let me address that by giving folks a couple, three alternatives. If you think you're having problems with your legs, maybe veins, first thing to do might be touch base with your primary care provider.
Okay.
They have the big picture. They don't just see veins.
Okay.
Second thing, every 3 months we offer a free vein screening on a Saturday. Next one's October 3rd.
Right.
But people think they have a problem. Come on into the office. We take a look at things, talk to them about their symptoms, and decide if it's something to pursue. Pursuing things, that means evaluating with an ultrasound to see how those valves work. Third alternative, you make an appointment with one of us to talk about veins. But a formal appointment, that'd have a nominal charge.
Sure.
But primary care, vein screening, an appointment.
Okay. So realistically, when I come to you and come to Providence St. Patrick and Health and Services, what can I expect as a reasonable result from my varicose veins? I mean, are they going to be gone forever? Are they going to look better? What can I expect when I'm all done with my treatment?
If you're symptomatic, if you fail conservative management, then we ought to establish expectations.
Okay.
What are we after?
Right.
We're after getting the symptoms better. If the goal is to make my legs look like they're 20 years old, I won't be happy with you.
Make me look like Betty Grable, okay?
But we want them to look better. But
Sure.
That's a secondary goal.
Right.
But expectations, treating symptoms, making those better.
Okay, great. Well, we're going to come right back. Dr. Bradley Pickhardt joining us this morning. Again, if you have any questions about varicose veins, how to treat them, maybe some symptoms that you might be having that you might want to pass along to the doctor, and you can say, well, see your primary physician. Anyway, give us a call. 721-1290 is our number. And this is Health Talk, and we will be right back. Health Talk continues right here on Newstalk 1290 KGVO AM, 1290 AM, and 101.5 FM, of course, online at newstalkkgvo.com. Dr. Bradley Pickhardt joining us here this morning. We're talking about, of course, he's a general surgeon, but we're specializing right now in varicose veins. And it's a shame folks can't listen in during the breaks because we have some really good discussions. One of the things that was asked was, when you close one vein, what happens to the other veins, and how does that all, because it is a pressurized system, how do you work all that out?
Well, the veins in our legs have a great redundancy. The deep veins in our leg do most of the work. They're the ones that are down by the arteries, by the bones. They're as big as your index finger. And we certainly don't scar those shut. Mm-hmm. The superficial veins that we ablate, that we close, you don't miss them.
Okay.
You don't miss them.
Now, you had mentioned that there are long veins and that there are shorter, kind of interconnecting veins, right, that are closed in different ways?
The deep veins in our legs that we've mentioned are the ones that do most of the work. There are the superficial veins, the greater saphenous, the lesser saphenous, superficial veins we can't see but are on top of the muscle. Then there's the ropey varicose veins that we can see. All of those are superficial veins. Perforating veins communicate between the deep and the superficial system going through the muscle. All of these have valves. All of them can contribute to varicose vein symptoms, chronic venous insufficiency. The perforating veins, the superficial veins, are the ones that we can really make a difference with.
So tell me about the valves. How do they work? I mean, does every vein have its own separate valve?
Every vein has many valves up its length. As the muscular pump of the leg squeezes, it squirts that red blood cell back toward the heart. When that muscle relaxes, the red cell would fall back to the floor. If we didn't have these one-way valves, mm-hmm. Snap open when flow is forward, snap shut when flow starts reversing. When those valves break down, that's when we end up with dilated veins, swollen legs.
So when you do the ablation and the surgeries, does that basically end the life of that particular vein, or is it just dormant then?
It closes that vein.
It does.
It's gone. And we're hopefully shunning blood toward veins that have valves that work.
So the whole idea is to keep that circulation going smoothly, right, from one end to the other, arterial to venous, that sort of thing, right?
Correct. Taking out the malfunctioning veins and pointing that blood toward veins that work.
Are there ever any problems going the original direction, from the heart down to the foot and then back up again? I mean, or is it primarily the ones coming back up that have the problems?
Arterial blood flow is absolutely essential. If I have blockages in my arteries, I'll have trouble walking. I could have ulcers on my legs. Being aware of the potential of arterial problems is certainly appropriate. Diabetic smokers are more prone to that.
I was going to ask you if there's any part of the population that is much more prevalent to getting varicose veins. You had mentioned diabetes, which is a terrible disease that affects so many symptoms of the body, right? I mean, so many portions of the body, systems.
But all of us can get varicose veins. Certain conditions predispose one. Maybe being female, standing up, obesity, many factors.
Okay, so basically, give us the big three in the way we can prevent getting varicose veins. Well, what are the three things that I can do starting today? I'm in my 60s, okay, to say, okay, I don't want to get varicose veins at my age. Okay, so what can I do?
Well, if I could answer that, I'd probably win some sort of Nobel Award. I'm not sure.
Sure, okay.
I could tell you how to do that. Stay healthy. Try to maintain a normal weight. Exercise. Work those muscular pumps.
Mm-hmm.
Other than that.
Now, for folks who are sedentary, or for perhaps have to be necessarily sedentary for a long period of time, like on a long airplane flight, for folks who have varicose veins, this can be a particular problem, right?
sedentary lifestyle is another risk factor for developing consequences of venous insufficiency, varicose veins. But on a plane flight, sitting around, just moving that foot, wiggling a toe, flexing and extending that ankle, all of those things are working that muscular pump.
We're almost out of time. How do we contact your department so we can get perhaps an examination from you?
Missoula Surgical, 542-7525. We can talk about our screenings or an appointment or whatever else.
Dr. Bradley Pickhardt, thanks for being a part of Health Talk. We appreciate it. You're going to be on again.
Look forward to it.
We have several appointments with you, so we'll try to keep those going. All right, and that's going to do it for Health Talk for this week for Providence Health and Services, Western Montana. Thanks for joining us. Again, thanks to Dr. Bradley Pickhardt and his expertise this morning. And we'll do it again next Monday from 8:30 until 9. We have an hour of open phones with